Hi, I'm Kevin Casey, head athletic trainer for Pine Township High School and the athletic trainer at Champion Fitness Physical Therapy. Today we're going to introduce part 2 of our Taping for Coaches segment, and today we're going to focus on 3 tape jobs for the knee. 2 are a little bit more complex, but the last one will be pretty simple. The first one we're going to look at is when an athlete hyperextends their knee, which is usually when mainly in football and basketball, when their knee will come and straighten out like that. Usually you want a typical little bend in your knee for support, but if an athlete does get that type of injury, this will be the simplest way to tape it. First thing you want to do is take a regular roll tape and have them put it underneath their heel so you get a little bit of a bend. And start with your pre-wrap, working on your way from the top, covering the whole knee all the way down. And you go once or twice. You're just kind of getting a little padding so the tape doesn't rub on their leg. It makes it a little bit more comfortable for them. Once you get, you'll be able to close that off so it doesn't fall off a little bit. Makes it easier for you. From there, you can either use white tape or a little bit thicker moleskin tape for the back of the knee. I like using the moleskin because it's more stable. What you want to do is start down the middle and go to the top of their calf, and notice there's a little bit of gap in that tape that represents that bend in the knee. Next piece, you want to start the X of the tape over that middle piece. And the third piece comes over like that. You've got your 3 pieces on the back of the knee. There are a little bit different techniques to close that off so it stays. You could go over it with pre-wrap again and use the white tape, but I like to use what I call horse tape, just to wrap a couple times around. And once you get that on, you can close it off with the white tape. Usually this stuff isn't that easy to tear, so scissors will be necessary. And all you need is a couple strips to close it off. So your athlete is ready to go. That is the conclusion of the hyperextended knee tape job. Now we're going to move on to the MCL tape job, which MCL stands for medial collateral ligament. And it is one of the more common injuries you'll see in pretty much every sport, from track, wrestling, football, baseball, softball. To tape this knee, usually I'll have the athlete have their knee bent up a little bit. And I usually start with pre-wrap like we did with the hyperextended knee. And work our way from the top all the way down to the top of the calf. And once again, your preference, you can go 1 or 2 times, but I like doing 2 times just so it's a little bit more comfortable for them. Once again, you're going to close it off with a white tape so it doesn't roll down. And just like the hyperextended knee, you can either use the white tape or I like to use the moleskin. And what you're trying to do is, since the MCL is right in that area, you're going to try to use these as a little stability force to make it easier for them to move around. So I'm going to have her straighten her knee a little bit, just like that. I'm going to start at the top again and go straight down right along the ligament. and once again mimic that X. On there for the support. And once we get that covered, we'll go to our horse tape again. And one thing I might mention is that if your school or you don't have the accessibility to tape the knee, we might recommend the athlete get a knee brace for the MCL, because in the long run it's going to be a lot cheaper. But if you don't have, or they don't have the accessibility to one, this will be the easiest way to make it stable. I'm just closing it off with the white tape again so it stays on. And that concludes the MCL instability tape job. Next we'll move on to the patellar tendonitis tape job. The third and final tape job that we're going to perform today for you is a patellar tendonitis tape job. This one is one of the more simpler ones and doesn't take very much time. What patellar tendonitis is the inflammation of the patellar tendon that lies right below the kneecap. And you'll usually see this in basketball players, but more commonly in track runners. It's just an inflammation of that tendon. So what you try to do is take the pressure off of it by taking some pre-wrap and rolling quite a few times around their leg. Just to create a heavy band, and you want to roll. Now hopefully it will stay right below kneecap, just like that. There's also a brace that, if the athlete is able to get, is a Chopat strap that is the same exact thing. It just has a little bit of fabric over the top to create some protection. And that is the conclusion of our knee tape jobs.